Welcome to section 3 of immunodeficiencies. In this section, we'll be discussing common variable immunodeficiency, or CVID. Let's get started. This scene will take place inside of an archery store called Archie's Indoor Archery. Off to the right, we can see a woman who has come in for a job interview. We can see that she's brought her curriculum vitae, or CV, along with her ID. Her CV and ID should help you remember that this image is all about CVID. The Archer store is a reference to bows, which should help you remember that this is a B-cell disorder. Now, unfortunately for this interviewee, pretty much everything is going wrong for her. First off, she brought her psycho kids along with her to the interview, and we can see them smashing up the business's decorations. Notice that the business has nicely framed and encased in glass the evolution or progression of bows through the ages. The bow off to the left is very primitive looking, and the bow off to the right is a bit more modern looking. Anyway, the bow is our symbol for B-cell, and this progression of bow development should make you think of B-cell differentiation. The fact that the kids are destroying the glass surrounding the bows should help you think of broken B-cell differentiation. In other words, in this disorder, there is a defect in B-cell differentiation. Another thing that's not going her way is the fact that the receptionist has no idea who she is. We can see her examining the ID and thinking, "We didn't ask you to come here for an interview." These question marks and confusion by the receptionist refer to the idea that in this disorder, the cause is unknown in most cases. The last thing that's not going well for her is the fact that she brought her dog along for the interview, and he's escaped. She asked her kids to watch the dog for a second, but they got distracted smashing up the store. Now we can see the dog running loose and causing all sorts of problems. Notice that the dog has kicked up some dirt along with some of those distinct infectious-looking particles. This idea represents infection. Also, a customer nearby is doing his best not to cough up a lung as all of these particles enter his airway. The cough is here to help you think of upper and lower airway infections, including sinopulmonary infections and bronchiectasis. So putting these ideas together should help you remember that patients with CVID may present with sinopulmonary infections and bronchiectasis. An astute employee noticed the chaos, quickly grabbed a net, and looks like he has successfully caught the dog. The net is our symbol for the lymphatic system, and the dog with the Cancer Hope ribbon around its neck as part of its dog tags should make you think of cancer. So together, these ideas should help you remember that patients with CVID may present with lymphoma. During this chaotic moment, a customer became distracted and accidentally shot himself in the foot. Now we can see the store manager who appears very concerned and is attempting to console this customer in pain. Anyway, the arrow represents an antibody, and the fact that he's shooting himself should make you think of antibodies that attack the host's body. In other words, this represents autoimmune disorders. So patients with CVID have an increased risk of autoimmune disease. The dog also happened to crash into another customer, causing some arrows to break into pieces. The arrows are a symbol for immunoglobulins, and the fact that they're broken should help you remember that immunoglobulins of all classes are low. So patients with CVID will have decreased immunoglobulins, such as IgG, IgA, and/or IgM. Finally, we've added another guy to the scene who doesn't seem too bright, and he has mistaken the Archie's Indoor Archery logo for a target. We can see that as he tried to shoot it, he missed and accidentally hit the business's plasma TV. The plasma TV represents plasma cells, and the fact that it's being destroyed by an arrow should help you remember that plasma cells are decreased. So patients with CVID will have decreased plasma cells. And with that, we've covered everything you need to know about CVID.